Since 1875, Good Samaritan Medical Center's commitment to exceptional care has improved lives and created healthier futures. Good Samaritan prioritizes advanced medical care and offers profound compassion for every individual and insightful innovation to ensure patients have the best treatment available. The medical center also serves as a teaching and research institution. Good Samaritan is proud to celebrate 150 years of service. We welcome you to explore our history as we look to the future of our medical center. Our story begins with Benjamin Wister Morris, who arrived in the state in 1869 in answer to a call by the Episcopal Church. He would serve as Bishop of Oregon. He saw a need for schools, hospitals, and orphanages and immediately began fundraising toward that effort. With support from Episcopal congregations, Morris purchased property at the northwestern edge of Portland and laid the cornerstone of the Good Samaritan Hospital and Orphanage on May 14, 1874, opening its doors on October 9, 1875. Good Samaritan cared for all patients and hired professionals from diverse backgrounds. The hospital grew rapidly in its first quarter century, and the orphanage closed in 1883 to make room for more patients. By the end of the century, the hospital treated almost 1,500 patients annually and was helping to educate the next generation of healthcare professionals. Good Samaritan advanced quickly in the first decades of the 20th century. The hospital campus expanded from an entire city block with a 250-bed capacity at the turn of the century to 5,861 beds by 1915. In 1890, a nurse by the name of Emily Loveridge helped professionalize and modernize Good Samaritan by opening a nursing school at the hospital. She insisted on visiting each patient daily, a practice she continued for 40 years. When Loveridge became administrator in 1905, she was the first woman in the country to oversee a 300-bed hospital. Good Samaritan opened Oregon's first maternity hospital in 1922, demonstrating its commitment to modern medicine, which increasingly favored hospital births over home deliveries. The hospital had earned the appreciation of the public by providing crucially needed services. During World War II, Good Samaritan faced a worker shortage as many physicians and nurses left for military service. Regardless, the hospital offered more specialty services during the war years, including radiology, orthopedics, and physical therapy. The latter became a national healthcare priority as many returning veterans needed rehabilitation. Good Samaritan continued to grow alongside the needs of its patients. A new main hospital building opened in 1952, offering the first post-operative recovery room in the city. The building boom continued with the establishment of the Devers Memorial Eye Clinic, the expansion of the School of Nursing, and the opening of the Physicians and Surgeons Professional Building. Good Samaritan transformed from a hospital into a regional medical center. The hiring of dedicated full-time physicians, an uncommon practice at the time, encouraged new research partnerships and training opportunities. As a result, Good Samaritan became regionally renowned for its focus on innovative research and care. Good Samaritan continued to modernize its facilities to meet growing demands for healthcare. The new west wing of the hospital opened in 1978, with new facilities for surgery, obstetrical and gynecological services, outpatient care, and the emergency department. Specialty programs continue to grow at Good Samaritan, with the opening of the Neurological Sciences Center, Comprehensive Cancer Center, Diabetes Institute, Kern Critical Care Unit, and Breast Health Center. As many programs expanded, others transformed. Good Samaritan joined the Legacy Health System, an umbrella organization that included other healthcare facilities and providers. The merger centralized services while continuing to provide the best patient care possible. Good Samaritan has continued its commitment to serving the community with compassion and expanding its innovative patient care. The medical center has earned national recognition as a leader in many fields, including cardiac care, orthopedics, and strokes. Good Samaritan prepared for pandemics and helped the community weather outbreaks. It expanded to offer urgent care facilities and invested in new technology. Today, Good Samaritan has many centers of excellence whose programs provide centralized and coordinated patient services through compassionate care, education, and research. The foundations of these stretch across Good Samaritan's history and include the Legacy Weight Loss and Diabetes Institute, Neurological Services, the Rehabilitation Institute of Oregon, the Legacy Devers Eye Institute, Kidney Transplant Services, the Legacy Cancer Institute. And just as Good Samaritan has done for 150 years, the medical center continues its commitment to treating all through such programs as the Legacy Gender Care Services. Over the years, Good Samaritan has been committed to serving the whole community. As we look towards the future, Good Samaritan is dedicated to providing the same compassionate and innovative care for all, for generations to come.